Florence Nightingale, the lady with the lamp, revolutionized the world of nursing and healthcare. Born on May 12, 1820, in Florence, Italy, Nightingale's insatiable thirst for knowledge and unwavering passion for helping the sick steered her towards a career that would change the medical landscape forever. During the Crimean War, Nightingale was sent to the British camp in Scutari, where she found appalling conditions: overcrowded hospitals, inadequate supplies, and rampant infection. Her tireless work ethic and innovative approach reduced the death rate by 2/3, transforming the practice of nursing. Nightingale's legacy extends beyond her wartime service. In 1860, she established the first scientifically based nursing school, the Nightingale School of Nursing at St. Thomas's Hospital in London. This institution of excellence set the standards for modern nursing education, emphasizing both training and compassion. Her groundbreaking book, Notes on Nursing, became an essential guide, laying the foundation for nursing as a respected profession. Nightingale's impact on healthcare is immeasurable, as she demonstrated that compassion, data, and organization could coexist in medicine. Her devotion to improving patient care forever changed the perception and practice of nursing. Honor her by advocating for quality healthcare today.